Welcome, future pharmacists of India. Today you begin a journey that goes far beyond counting pills or reading prescriptions. Your path into medicine starts not with drugs, but with the cell, the tiny living building block that makes all life possible. Imagine you're dispensing paracetamol to a patient. Have you ever wondered how that tablet knows where to go, or how it relieves pain? The answer lies in the world of cells. Every action in your body, from breathing and thinking to healing a wound, happens because of millions of cells working together, like a perfectly coordinated orchestra. Understanding cells is the foundation of all medical sciences. As a pharmacist, this knowledge empowers you to ensure patients get the right drug at the right dose with the right advice. Diseases like infections, cancer, and diabetes all begin with problems at the cellular level. When you understand cells, you understand the root of disease. Think of drugs as keys and cells as locks. Each medicine is designed to fit a specific cellular target, unlocking healing or blocking disease. Your deep understanding of cellular biology sets you apart as a healthcare professional. Patients trust you to explain not just what medicines do, but how and why they work. This journey into the microscopic world of cells is the first step in your pharmacy education. The more you learn about cells, the more powerful and compassionate a pharmacist you will become. For centuries, our view of the cell was limited to faint outlines seen through primitive lenses. Early scientists could only guess at the mysteries within. But with the invention of advanced microscopes, a new world opened up. Suddenly, organelles and cell structures came into focus, revealing the complexity of life. Today, global projects like the Human Cell Atlas are mapping every cell in the human body, like creating a Google Maps for biology. With tools like fluorescence and electron microscopy, we can now watch drugs interact with cells in real time, track organelles, and even see how diseases progress at the microscopic level. This revolution is transforming pharmacy. We now know that even within a single organ, there are many cell types, and each may respond differently to the same drug. Thanks to these advances, personalized medicine is becoming a reality. As future pharmacists, you'll use this knowledge to tailor treatments, making care more effective and precise for every patient. Picture every cell as a tiny fortress, protected by a remarkable structure, the plasma membrane. This flexible, selective barrier is made of a double layer of lipids, with proteins floating like islands, constantly moving, always vigilant. The membrane decides what enters and leaves the cell: nutrients, water, and crucially, medicines. For a drug to work, it must first cross this barrier, like a key fitting into a lock, or sometimes sneaking through a hidden gate. Some medicines, like anesthetics, dissolve right into the membrane's fatty layer, slipping inside with ease. Others, like beta blockers, must find and bind to special protein receptors on the surface, like ringing a doorbell to be let in. Some drugs use transport proteins, tiny molecular machines that ferry them across, ensuring only the right substances get through. Understanding these pathways helps pharmacists design drugs that reach their targets, avoid side effects, and work efficiently. For example, insulin cannot enter cells without a special signal, just like a VIP pass at a concert. As a pharmacist, knowing how this cellular gatekeeper works is fundamental to understanding how medicines act at the most basic level. Once a drug enters the cell, it enters a bustling world of organelles, tiny machines, each with a vital role. The mitochondria, often called the cell's powerhouses, generate energy for every heartbeat and thought. Some antibiotics and cancer drugs can damage mitochondria, leading to fatigue or organ toxicity. The endoplasmic reticulum, or ER, is a protein factory and detox center. In the liver, it breaks down medicines like paracetamol. Overdose can overwhelm the ER, causing liver damage. Lysosomes and peroxisomes act as the cell's recycling and defense units. Some drugs, like certain anti-cancer agents, can disrupt lysosomes, leading to cell injury. At the center is the nucleus, the command hub, storing DNA and directing all cell activity. New gene therapies, like those for sickle cell anemia, target the nucleus to correct genetic errors. For pharmacists, understanding organelles means predicting how drugs work, why side effects happen, and how to personalize treatments for each patient. Blood is like the highway system of your body, connecting every organ and tissue, delivering not just oxygen and nutrients, but also medicines to where they're needed most. Blood is made up of plasma, the liquid part, which is mostly water but packed with proteins like albumin that act as taxis, carrying drugs throughout the body. Imagine albumin as a bus. Drugs can hop on for a ride, but only those that hop off, the unbound drugs, can actually work in the body. Red blood cells, or RBCs, are like delivery trucks, transporting oxygen to every cell. If these trucks are blocked or damaged, tissues suffer. White blood cells are the body's security guards, fighting off infections. Some medicines, like chemotherapy, can weaken these guards, making patients more vulnerable. Platelets are like emergency repair crews, rushing to stop bleeding by forming clots. Drugs like aspirin slow them down, while warfarin makes their job even trickier, so careful monitoring is needed. As a pharmacist, understanding these blood components helps you predict how drugs will travel, act, and interact, ensuring your patients get safe and effective care. Remember, every medicine you dispense takes a journey through this river of life, so your knowledge of blood is key to helping, not harming your patients. Every medicine's journey begins at the cellular level, where science and care meet. As a pharmacist, you are the bridge between complex biology and patient well-being. Drug molecules must find their way to specific receptors or enzymes, like a key searching for its lock, triggering effects that can heal or harm. Your understanding of these microscopic interactions empowers you to ensure medicines are safe and effective for every patient. Genetics play a powerful role. Pharmacogenomics reveals why two people may respond differently to the same drug. For example, some Indians have genetic variations that slow the breakdown of common medicines, making personalized doses essential for safety. Pharmacogenomics is not just science, it's a tool for compassion, helping you tailor treatments to each individual's needs. New drug delivery methods, like exosomes and nanotechnology, are revolutionizing how medicines reach their targets. As a pharmacist, you must stay curious, always learning, always connecting science to real-world practice. Your duty is to educate patients, guide them through their treatment, and ensure every medicine helps, not harms. With deep knowledge and empathy, you become a trusted healthcare guardian, ready to shape the future of pharmacy in India.